Hello, my name is Dylan Rogers, and today I'm going to be talking to you about Lyme disease. Lyme disease is caused by a bacteria known as Borrelia burgdorferi, which is spread by a genus of ticks called the Ixodes genus. It is caused from prolonged tick bite, so a tick bite that lasts from 36 to 48 hours, and is the most common tick-borne infection in North America and in Europe. The bacterium is first spread to ticks from a reservoir host, such as the white-footed mouse here in North America. The tick will bite the host, collect the Borrelia burgdorferi bacteria, and once it is infected, anybody that it bites and has prolonged exposure to will be infected with Lyme disease. So, isolating the burgdorferi. This is done in a lab with light field microscopes. It is best to view a tissue section or a blood smear. This is not a preferred method for diagnosis, but this is how you would isolate it in the lab. You use a complex medium known as BSK, so Barber, Stoner, Kelly, and it is named after the scientists who have helped develop it. They've each had their input over a period of time. Each of them has just added on to it to make it that much better at helping cultivate B. burgdorferi. It'll be cultivated best in a neutral pH in a microaerophilic environment from anywhere from 30 to 37 degrees Celsius. It'll then be monitored under these conditions for 4 to 6 weeks using a dark field light microscope. If there's any growth, typically will occur in the first couple weeks, but they give it up to that 6-week period. And if there's growth, it's showing yes, there is B. burgdorferi here. It is positively Lyme disease. Transmission. An infected black deer tick will bite its prey, latch on, and suck blood for long periods of time. Ticks like to suck blood for a long period already, but an adult tick is more easily found on the body, so it is typically nymphs, the immature tick offspring. They'll be very, very small, 2 millimeters in size, something you don't really feel or see on your body. And that is typically where most successful transmission of Lyme disease is caused. It's from the tiny baby nymphs. Because like I said, 36 to 48 hours, it's a long time to have a bug on your body actively feeding on your blood. So by the time that anyone notices it, usually it's too late. It will, here's the pathogenesis. Borrelia enters the vascular system from the initial tick bite. It has to evade both the immune system of the tick and our immune system for successful infection to happen. So as it crosses into our vascular system, it's dodging white blood cells, all of our macrophages trying to kill it, and it is extremely motile. So it is very capable of being invasive. It'll escape the vascular system by tethering, dragging, or extravasation, and attempt to spread throughout the body. One of the most common places that it spreads to, it will pierce the blood-brain barrier and make its way into the CNS. And that is when most of the serious symptoms start. In the CNS, as soon as it enters, there will be an inflammatory response. And as it adheres to neuronal cells, it can be cytotoxic for them, and this can cause some neural dysfunction. And it also cause, like I said, inflammatory response, so a lot of swelling of the brain and spinal cord, and those are the most serious symptoms. But the early symptoms, fever, chills, headache, nausea, body aches, pains, very vague symptoms, usually accompanied with a rash at the site of the tick bite. And it will often look like a bullseye rash, red in the middle, and then an outer ring of white and another ring of red. It'll be very large and non-painful for the patient. This does not happen in everybody, though. It's not every case. But this is called erythema migrans. The late symptoms start to get more serious. You get severe headaches, neck stiffness, facial palsy isn't uncommon. You'll have loss of muscle tone in one side of your face, sort of like Bell's palsy. Arthritis, big symptom, very common. lots of joint pain, swelling at the joints. Big joints like the knees will become very swollen. In the past, before Lyme disease was properly discovered, it was misdiagnosed, thought to be juvenile arthritis in several cases. Some more serious symptoms: if it spreads to the heart, it can cause heart palpitations, it could cause dysrhythmias, it can cause just dizziness, and if it has spread to the CNS, swelling of the brain or spinal cord, which is by far the most serious symptom. Not that arrhythmias aren't serious, but brain swelling can very quickly kill you as well. Diagnosis. Testing for Lyme disease is typically done with antibody testing. They'll take a blood sample and test your blood serum if it's positive for antibodies. They're looking for the IgM and IgG antibodies. However, this is also not foolproof because it takes time to build up antibodies in the body. So if you were infected, say a week ago, you're starting to have symptoms, you go to your doctor, you got tested, and they did happen to test you for Lyme disease, you might still come up negative. It's really up to the physician to look at your symptoms and then place their diagnosis. So if you had that classic bullseye rash, there you go, positive, most likely positive diagnosis. But the CDC is actually still looking for a more effective diagnostic method. But right now, antibody testing is the best one that we have. The blood serum is tested in a two-step process, first using an enzyme immunoassay, and if that is positive, then they'll do a Western immunoblot assay. If both are positive, it is thought, yes, you have Lyme disease. Treatment is usually recommended to take a course of oral antibiotics like doxycycline or amoxicillin. Usually all it takes is one course to kill it. Oftentimes, symptoms will persist, and sometimes an IV antibiotic treatment is prescribed. However, post-treatment Lyme disease syndrome is what it's called when you have recurring symptoms post-treatment for Lyme disease. It tends to be chronic, and a lot of the symptoms tend to last for quite some time. There are some natural antimicrobials available for treatment in the form of oral droplets. Substances like Cumanda and Cemento have been recommended. This is mostly symptom management. And a lot of PTLDS symptoms, it's really hard to know why they are still happening or how we can help treat them. It's often just a case-by-case basis done by that person's primary care provider. Prevention of Lyme disease is best bet. Try not to get it. It's essentially, to prevent it, you have to prevent exposure to ticks. So any outdoorsy areas, your tool shed, might have some ticks there. You're going to want to seal up cracks in your home, any holes, maybe use pesticides in your yard. If you have pets, definitely pesticide the perimeter of your yard. Keeping ticks away from you will keep Lyme disease away from you because they're the most well-known causative factor of Lyme disease. Anything you can do to prevent exposure with tick will help you here. Wearing long socks, long sleeves if you're out in the woods, checking your skin thoroughly when you get home, taking a shower immediately. Those things can help prevent a tick from staying on your body. In conclusion, there's still much that we have to learn about Lyme disease. Like I said earlier, the CDC is still looking for a more effective diagnostic criteria. Antibody testing right now is really what we have. And it's definitely not foolproof. There's a lot of flaws with it. If you were sick in the past 30 days, you might come up false positive for Lyme disease. So they're still working on a better method. And post-treatment Lyme disease syndrome is still something we don't know a lot about. The symptoms are quite vague, they're very chronic, and it's unclear still how we can help prevent that. So, this has been my presentation on Lyme disease. Thank you.